like to welcome everyone and call to order the Board of Health meeting on September 9th, 2024. It is 6:01 p.m. and we'll do a roll call for attendance. Stephanie Granger here, Michelle
here,
Sue
here,
Megan
Here.
and Joanne
Here.
So it is everyone is in attendance. That's great. And we will move to open forum. It looks like we have a few extra participants.
I don't see any hands raised at this time or anything in the Q&A or chat.
Okay.
Oh, wait a minute. Okay, hold on 1 minute. We have someone here, Kathleen Lynch.
Okay.
Can you hear me?
Yes, we can. Go ahead.
Okay, is this the open forum time?
Yes.
Okay.
Can you state your name and your address for the record, please?
Kathy Lynch on Rush Road. WestfordCAT reported only one recent case of triple E and one of West Nile virus, and fewer than 1% of those infected develop a serious, sometimes fatal neurological illness. We all want people safe. Let's not overreact by causing more harm through mass spraying. Health Director Ray Dick shared public safety data for Zenefex E4 that she said would be used if approved. The safety data sheet includes ingredients etofenprox 4% and unknown ingredients of 96%. The sheet says caution hazards to humans and animals, avoid contact with eyes, skin, or clothing. It's highly toxic to bees. Don't apply to blooming crops or weeds. Aspiration pneumonia hazard, combustible, covered drinking water fountains, and animal feed. Hazardous to fish, ponds, marshes, and swamps. Public employees for environmental responsibility conclude aerial spraying is largely ineffective at a cost to taxpayers of $2.2 million. Aerial or truck spraying of pesticide on school property and parks is toxic for everyone, especially our youth, elderly, and those with weak immune systems. Mosquito breeding weather is almost over, and there are reasonable precautions we all can make to avoid mosquito bites. Avoid going outside when mosquitoes are most active, dusk and evening. Wear clothes that cover the body. Remove standing water where mosquitoes breed. Apply bug spray or other natural mosquito repellents. Remember, pesticides kill all insects, even beneficial pollinators like butterflies and bumblebees that are essential for growing food. I'm asking for you not to risk harm to the people of Westford by mass spraying. With reasonable individual protective measures, we can combat this issue. Thank you.
Thank you, Kathy. Lean, sorry. Okay, so we'll probably discuss that more later and appreciate hearing your thoughts on that. Is there anyone else for open forum?
I do not see anybody at this time.
Okay. So then we can, well, that the agenda item for that is at 6:15 to discuss spraying for mosquitoes. So we'll keep that in consideration then. So we now have the approval of the minutes from the August 5th, 2024 meeting. Did anyone have any comments or changes for those?
I didn't see anything.
I didn't either. Anyone else?
I wasn't there.
Sorry, I have my mouse. Where'd it go? Everybody's off screen for me at the moment. There it is. Okay, so is there someone who'd like to make a motion then to accept the minutes?
I'll make that motion.
Okay, Michelle makes that motion. Is there a second?
I'll second.
Megan seconds. All in favor? Stephanie, aye. Michelle?
Aye.
Sue?
I'll abstain because I wasn't there.
Okay, Megan?
Aye.
And Joanne?
Aye.
Okay, motion passes with the 4 in favor and Sue abstaining. Great, and thank you to our minute taker. Sorry, now I covered up. Okay, so we're a little early to discuss the mosquitoes. I don't know if we want to talk about the department budget or something out of order, and just in case anybody else wants to join us for the mosquito discussion.
Sounds fine.
Sure. What would you like to discuss? Which item? Sorry.
We could either do the strategic planning or the budget, department budget.
Okay. Alrighty, in your packet, every year, we provide department goals for our health department. What we do is we meet as a group at our monthly meetings and discuss some of the accomplishments, and we also look at goals for the next fiscal year. Each person who is non-union also receives a review and is asked to provide their own personal goals, any goals they'd like to see for work-related goals. And so we factor those in as well with our department goals. We also keep track of things during the year that come up. Oh, geez, wouldn't it be great to have this regulation, or we really need this regulation, that kind of thing. So we keep track of those. So in your packet, we do have a list of health department goals set. We are in the middle of our strategic planning process, which is a requirement for accreditation. We would look at our community health assessment, improvement plan, and the third piece is the strategic planning. So we're just starting that process, just in the middle of putting together our stakeholder group for the strategic plan. And as that evolves, our department goals may also evolve to include, for instance, more mental health, substance abuse, things of that nature. But these are the outlying items that we felt as a department are needed for this year. So I just wanted to bring those to you, see if you had any questions, concerns, wanted anything added, taken off, that kind of thing.
So I have a question. So what were you just saying about, like, I don't see anything about mental health in this. So that's a separate, those are separate goals?
So right now we address mental health, substance abuse, community health year round.
Okay.
That's something that we also work on with our community behavioral mental health committee as well.
Okay.
And also we have the Coalition of Nonviolence, so we're addressing healthy relationships, mental health with children, domestic violence year round. If there's any outlying initiatives, that's something that we can certainly add to the department goals. But just for instance, environmental health, that's something we do year round. So if there was something specific you wanted for mental health, we would certainly address it. But as mentioned I think it was 2 meetings ago when we went over the community health assessment improvement plan, the top 3 items, one was mental health, substance abuse. Abby, what was the third? Do you remember? Was environmental health?
I think environmental, yeah.
Yeah, I don't have it right in front of me. Yeah, we can certainly add whatever you'd like, but that is something that we address year round, and we would work closely with Nicole, lovely who's a community wellness coordinator.
I'm just wondering whether, like, it should be in there, continuing something about, because they are the top issues. So not having it in there, I understand what you're saying, but if somebody were looking at it, they'd say, well, where's the mental health goal, for example? So I don't know, does it make sense to put even in there continuing we continue year round to address or something, because it feels like it's missing, but I understand what you're saying. But as an outsider looking in, I would be like, well, wait a minute. If the big issues are mental health, substance abuse, environmental, why is it not mentioned in our goals? So I don't know, something just about,
Absolutely.
Yearly, I don't know, just a thought.
Yeah, one bullet point that says, high priority, consistent efforts and goal, work with committees and goals in these field areas or something.
Okay, no problem.
I have a question.
Joanne.
Are we done with that? I don't want to interrupt.
No, I think.
Yeah, okay. So my question was about the 2 bullets on the regulations, the demolition and the rooming house. Can you just talk about that a little bit? I'm just curious. Do I need
Sure,
to bring that
so, no,
to
that's,
where I am?
no, that's okay. So here in Westford, we work closely with the building department. We do conduct demo inspections. So if someone's coming in and they're going to take the whole home down, there's a permit application, and there's also several state regulations for demolishing a property. A lot of health departments have local demo regulations. For instance, here in Westford, we don't have any kind of requirement that they have any kind of pesticide check when they're
Okay.
taking down the building. And so we do get some complaints about, neighbors aren't notified. There's issues with pest control. Sometimes there isn't water at the site to keep all, for instance, asbestos or lead airborne to keep down. So that's something that we've talked about in our department for the last 2 years, about having a local demolition regulation.
Yeah.
Where is this? Where, I'm
No,
sorry.
it's a really good idea. We do, they have to have an
listed
IPM
where?
plan and stuff, so.
And the
Yeah.
same with rooming house. Mass General laws require a rooming house permit. And we've actually seen with the issues with housing availability here in the community in the last 4 years, we've had an increase in rooming housing, illegal rooming housing complaints and violations. So, again, talking here in the department, many health departments have local rooming housing regulations just to keep people safe. And so that's something that we'd like to address for this year, this fiscal year.
And there are regulations at the state and DEP level regarding asbestos abatement and lead abatement. So the state does require permits for any kind of demolition of those materials.
Yeah, but they're not probably getting to over to Ray, right? So that would be part of it. So if you're not seeing, even though they're there, if they're going to the building department, say, and you're not seeing them, this would help everybody staying on the same page, right?
Correct.
Okay. And zoning doesn't have or do they already for the rooming houses? Are they
They do have for ADUs, and they also for Airbnbs for short-term rentals only.
right? Okay. Okay, cool. Thank you. That's just
You're
curious.
welcome.
Good idea. It's always good
Yeah.
to look through all your regulations, update them, and tweak them where we need them. Thank you.
Are there any other questions or comments on the goals? Okay. Then great, thanks, Ray. And I think at this point we can move to our 6:15 agenda item, which is the emergency waiver to spray Westford Public Schools and parks for mosquitoes. We heard from Kathleen Lynch expressing concerns and opposition to spraying. I had an email from a resident expressing concern and asking for more information about how that decision would be made, being concerned about pesticides. Ray, do you want to share some of the updated? I know Kathleen Lynch said there was only one case. There have actually been quite a few more.
Sure. So what happens is, it has been happening since June, is the Mass Department of Public Health, excuse me, and the Homeland Security Network, what they do is they notify boards of health and health departments about all kinds of communicable diseases, but specifically in this case for Triple E and West Nile mosquito-borne illness. And we track it. We track it throughout the whole summer, right into the fall. This is not something new here for Westford or for Massachusetts. We are required to follow what's considered the Massachusetts Arrovirus Surveillance and Response Plan. That's the state plan. What it does is it pretty much categorizes positive mosquitoes and positive cases for Triple E and West Nile. And so what that does is it puts it in different categories for your community. There's an online state map that's public. Anyone can see that. And what it does is it puts you from low to critical positions for your city or town. Westford throughout this whole point has been in the low category, and we've been watching that. We put out all kinds of education, just reminding folks, hey, by the way, long sleeves, wear mosquito repellent that has DEET in it, and all different other items like fixing your holes on your screens, things of that nature. So up until Thursday night, Westford was just moved into what they call a moderate level. There have been positive mosquitoes in our area in Middlesex. There are 4 cases of EEE, 2 of which are in Middlesex County. There are 299 West Nile positive mosquitoes since June. Right now, Littleton, Acton, Carlisle, and Ayer have been moved to a high level, and they sit right around us. Acton, as you probably saw in the news, just had a positive mosquito. And so this is something where we have this discussion to bring it to the Board of Health to see where exactly do we want to start? Do we want to do more than education? And certainly we look at the environmental impacts, the health impacts, but we want to protect the community as well. I say that what we did is we reached out to our state epidemiology program where we were moved up and to get their assessment of the situation. At this point, they did recommend education. They recommend possible spraying, starting with schools and parks, but to talk to our Central Mass Mosquito Program. We're speaking with the director on Thursday and Friday. He recommended spraying the school fields and the parks, which would include the Road and Bush. There are over 10 different parks in all of the school fields, as well as East Boston camps, or what's considered stony conservation land. So speaking with the schools this week, speaking with recreation, the next possibility would be this Thursday. What happens is when the temperature goes up, there's more mosquito activity. Wednesday, Thursday is 80 degrees this week. They need to do that spraying before it gets cool. But we generally don't have a concern of EEE and West Nile as soon as we hit the first frost, which would be 28 degrees or below. So these are just some of the facts. You know, considering this, tonight we're asking for an emergency waiver to spray the school fields. There are over 30 different laws to spray a school field, in which case you would need to give 48-hour notice to both parents, children, and teachers to spray on the school field. The Board of Health, per Mass General Law, has a right to order an emergency waiver, to vote on an emergency waiver so that we bypass that notification in order to spray sooner. So our hope is to spray Thursday. If the board tonight does approve of the emergency waiver, we would let the schools know anyway. I've already been speaking with our superintendent, Dr. Chu. We have already put out news flashes, not only on the town website, but the health department's website and social media platforms. And we would make sure that the information went out to all of the schools.
Can I ask a question?
Sure.
Yeah, sure. Sue.
So when would the spraying happen?
Right now, Central Mass Mosquito said the earliest that they could conduct the spraying would be Thursday evening. And they
Thursday
would
evening. Okay,
about
so
that.
in other words, sports and all that, this would be after, or would there be no sports that evening?
There would be no sports or
no
after school
sports.
activities on Thursday. We would make sure to get that information out ahead. Again, speaking with recreation director, speaking with our Department of Public Health Works and our facilities at school in the schools, we would let everyone know that these incidents would be canceled for this one day of spraying. Now, also speaking with Central Mass Mosquito and the epidemiology department, they did, it's certainly up to this board, but until we have a positive mosquito here in the town, they did not encourage limiting any after-school activities at this time. But again, that is up to your purview.
And what are like some of the local towns are they, you were saying they are high levels now, so are they all doing the same with the spraying?
They are. So they are spraying. Some are aerial spraying, meaning their entire community, again, because they've had a positive person, not just a positive mosquito, but a positive person with EEE. And these communities that are high, some are limiting to after school, no after school activities at all.
Wow. Okay.
Now, I
So,
will say to Westford about 5 years ago, 2019-20, this, like I said, this is not new for our community. About 5 years ago, we were in a similar situation and we did spray the fields. And I think I did put that list in your packet so you could see what parks and schools. And
Yeah,
that's
I wanted to,
public.
okay. I'm sorry. I thought you said that in Acton there was a positive mosquito, but it was a positive case, correct? In
Correct.
Acton,
That was in the news, actually, yeah.
right.
Yeah.
Michelle,
Can I ask a question?
yeah, Megan.
So was the recommendation to spray the fields in the school done based on, when I was looking at their website, it looked like they were gonna assess mosquito activity before they sprayed. So, maybe I was reading it wrong, but anyways, are they gonna go and, like, if we say, go ahead, spray, will they assess the situation and see if there's enough mosquito activity to warrant spraying, or is it just like, go spray?
No, so Central Mass Mosquito looks at several conditions. The wind, if it's too cold, you can't. But Wednesday, Thursday, actually tomorrow, it's supposed to be 77. When the weather gets warmer, there's more mosquito activity, and it's the best time, in their opinion, their professional opinion, to spray. So they, they're unfortunately, like Westford, there's so many communities in this situation right now where they can only do so much with capacity. So the earliest they could get out is Thursday.
And Megan, they do monitor mosquito activity all summer long.
Yes, they do.
There are
Yep.
certain points near swamps and such where they have actual collection sites for mosquitoes. They go to the State Lab Institute. That was my first job out of college. They test the mosquitoes to determine whether or not they're carrying West Nile or Triple E, and they use that information to determine whether or not spraying is necessary.
And I would just add that Central Mass Mosquito, if you go on their website, this does not cost extra for taxpayers to have this treatment or spray. I know we've had those questions. This is already part of the program. This is what they do. This does not cost the taxpayer extra money. But again, a public health, concern at this point, and, certainly up to you. But I do want to let people know that you can go to their website as well as the Mass Department of Public Health. They have lots of frequently asked questions about the chemicals that they are using, why they're picking. There's over 15 different chemicals, or I should say options for this kind. And in this particular chemical, that I know Kathy had mentioned, and it's also in your packet, is what they're recommending to use.
So, sorry, my question though, I think maybe I was unclear, was that some of the schools have more mosquitoes than others. So, and then based on whether or not there's a body of water nearby, or, whatever the other circumstances are. So I was just saying, like, is there any like picking and choosing, or is it just a blatant decision, all the schools, all the fields? That's all I meant.
It would be a blatant decision to do all the schools, regardless of whether there's more wetlands or there's a pond or lake or that kind of thing.
Joanne?
Well, just a couple of comments, and maybe talking a little bit to what Megan was saying too. So we don't, I think it's not, it makes it not arbitrary. So we want to protect all the children, equally. So that's why that they will check first to see what the activity is. But there was a couple things I think that were mentioned earlier on, and things that over the years that I've learned being on this board for a long time, we've done this multiple times, not just 5 years ago. We did it probably 4 or 5 times on all the years that I've been on, every few years, because this is all happens cyclically. Every 3 to 4 years we have these cycles, and we're in a particularly bad one right now. So it isn't something that the town has never done before. We have sprayed the fields. We've never done, I think only once, maybe twice, we've done general spraying throughout the town where people can opt in and out. That was another particularly bad year, but we're not even talking about that right now. It's more about just the fields. And, the time of day is also really important to understand too. So the bees are not flying, the butterflies are not flying. They're doing this at the time of day that the particular mosquitoes are flying, which is into the dusk time frame, which is also very important. I mean, it's a very thoughtful process. It's not, it is a chemical, and I get it, you know, I certainly do get it, but it's not done without a lot of thought and without a lot of experience. And this is, you know, always a problem in this southern part of the Commonwealth, down in, you know, the Marshfield area. They deal with aerial spraying all the time. So, you know, I think when we're starting to see these human cases, it does get a little concerning. And especially with Tripoli, where, you know, it may be not that common, but it is a very severe, scary disease should it happen to you or your family member. So, you know, I am concerned. I am, you know, I've been watching it, and we did find out about the person in Acton. Usually they'll just give a, you know, a county, Middlesex County, but we've had cases of Tripoli and West Nile. So you know, I am concerned. And looking at the weather forecast for the next 10 to 14 days, we're nowhere near frost. It's going to be 85 degrees on Friday. So we're kind of a long way away, you know, in hoping for the frost to come in and do, you know, the job for us. You know, if this keeps up, it's going to be a while. So I thank Ray for bringing this up and bringing this to us. It's not an easy decision, but it is one that we have to, you know, discuss and face. And I think the first step in protecting, especially the kids, you know, is the fields.
Thank you. Ray, or anybody else who has the answer to this. I was looking through some of the materials that were coming from the state, and they also indicated that they were finding dengue in Massachusetts. That's really concerning as well for anybody who understands dengue, because that's a disease that if you get it more than once, it can be very fatal.
Yeah, they are tracking those mosquitoes, and it's, you know, for sure. And, you know, and others. There's all kinds of vector-borne diseases that are making their way into places they never were before because of climate change and, you know, changes in the ocean temperatures and things, and they're coming up the coast. So, you know, a lot of times in the past we would see malaria and, you know, dengue or, you know, something else odd, and it was from somebody who traveled. But now, you
Now
know,
it's just spreading.
well, yeah,
or
now they're
more
really concerned and watching and tracking all the, you know, trapping, like Michelle said, and looking at the different mosquitoes that they're finding.
Yeah, and I think I was part of a decision previously to do some of the spraying. Having a case as close as Acton, I think that's closer than we've had it in even maybe in the past. That's, you know, adjacent to Westford. It's concerning.
Well, and I think too, just to mention, you know, there are no borders when it comes to mosquitoes. And I say that today, you know, a lot of people say, oh, well, you know, this age bracket's more, you know, they tend to get it. I get a lot of those calls. That's not the case. You know, today there was a positive case for a gentleman that was in his 50s. You know, we had just had a case in New Hampshire where they were in their 40s. So I think it affects all ages, and you can see that again, like I said, on the state website. We do have those links out if folks from home want to be able to review those maps, see all the data. And again, Central Mass Mosquito keeps all the data for Westford. You can see the traps, the samples, things that are collected, and the data for the last 5 years for our county.
Triple E has also affected young people, like teens and younger. It does not respect ages. Joanne, are you raising your hand or no? Okay. All right. Do we have any other comments from?
We
You
do have a
can.
raised hand.
We do
Yeah.
have a raised hand. Okay. Dr. or Stephen Gopil.
Yep. Hi, Ray. This is Stefan Gopal. I just had can you hear me okay?
Yes, thank you. Sorry for mispronouncing your name.
No, that's okay. Yeah, I mean, first off, I thank you guys for inviting me to this. I want to echo everything Joanne said as a physician. Tripoli is pretty scary to me, just as much as dengue. I was curious, Ray, if you could answer this question, again, knowing that mosquitoes don't respect borders kind of thing. With all the surrounding towns being in the high category and us still only being in the moderate category, and sort of picking up on some of the clues that it can't be that all of those towns had human cases since it was just Acton. What is some of the other factors that are just missing right now to kick us up into the high category kind of thing? Is it just more positive mosquitoes found in our town, or are there any other big ones besides human cases and mosquito cases that play in that role of moderate versus high?
Yeah, what would shift us? I hope this answers the question. What would shift this community from moderate to high would be a case where a human would have a positive Tripoli or West Nile.
So do all then the town? Because I thought you said that it wasn't just so it was Littleton that was it Littleton or Acton that had the human case?
Acton.
But Littleton is in the high category at this point. Did I
They
hear that
are.
earlier?
I don't
So
know if their community what they don't share specifically with health departments. They share the county, and so whether it was a positive, for instance, there's been 2 horses.
yeah,
To animals.
okay,
If they have a sample, they take so many samples of mosquitoes. And if they get a positive mosquito case for Tripoli, they will also notify you, and the Department of Public Health could bump you to a higher critical category. But typically it is the Department of Public Health that moves you depending on if you have an actual case of Tripoli of West Nile, if they consider, like I said, if there have been samples where you've had positive West Nile and Tripoli. And again, that would be from Central Mass Mosquito.
okay, thank you. Yeah, so no, this is scary to be surrounded by towns that are all high. I mean, it just takes, as you said, the wind breeze blowing the mosquitoes the wrong way kind of thing. So thank you guys for looking into this and making an informed decision. I appreciate it.
Thank you. And I'm sorry, I forgot to have you say your name and address for the record.
Yeah, so Stefan Gopal, 19 Robinson Road.
Thank you very much.
Yeah, you're welcome, Stephanie.
The other thing I wanted to mention too, and Ray had mentioned it, was the arbovirus plan. So that is on the Department of Public Health's website, and it actually does go through the steps. And that's what, we all follow. I don't know, people that are here know that I also work in public health. So, we follow that, and that's another way that we get, the communities get lifted into the different levels. There's a whole algorithm as to how everybody moves and why. So that's also on the website. And yeah, I mean, I don't know how we know the person was in Acton, how that leaked out, but we always get the notification initially just by county.
Yeah, I guess maybe that was the news that.
Yeah, usually the news knows more than we do. If somebody reports it and says it themselves, that's one thing. We can't report that out. That's
but it's helpful for us to know, honestly.
Of course. But
that it's a community adjacent to ours in terms of making the decision. Because I don't take pesticides lightly at all. It's a concern, but Tripoli and the amount of time we have left with warm weather is really concerning. It is, it's high risk, and it's a concern. So I think I'm willing to support the emergency waiver. I don't know if there's anybody who has, other feelings they want to express before we take a vote, or Ray, are you?
Yeah, just sorry. We do have Kathleen has one more, has her hand raised.
Okay.
But I just wanted to also add one quick thing. As Joanne mentioned, we as a health department and as the Board of Health don't just get to decide out of nowhere, we should start spraying. Again, there is a plan that we have to follow, the state surveillance and response plan with a situation like this. And it moves your health department through each level. So I just want to mention that to the public. And let me see if I can, because certainly, we have a environmental health division, and so we are very cautious that we want to make sure that we're not killing butterflies or bees or hurting our wetlands or conservation areas. So I just wanted to add that we look at the whole package.
I also thought it was interesting in reading about it, that it says that these chemicals break down within 24 hours or something in the daylight, that they really become not a problem for humans within that time frame. Okay, Kathleen, if you'd like to speak.
Yeah, thank you. So I can see that you're getting ready to take a vote for this, but I just wanted to clarify that one of the articles I saw was, it says 2 more cases of serious mosquito-borne virus confirmed in Massachusetts. It said state health officials announced Thursday that an additional human case of well, they have that written twice, of Eastern equine encephalitis and 1 additional human case of West Nile virus were confirmed in Massachusetts. And that's what I was going over earlier. Both cases are men in their 70s. Officials said 1 man was exposed to Triple E in central Middlesex County, bringing the total number of Triple E cases in Massachusetts this year to just 3. The other man was exposed to West Nile virus in southern Middlesex County, marking 7 cases of West Nile virus in Massachusetts this year. And just those numbers it just did not look alarming to me. I know you're thinking otherwise, but I just wanted to tell you where I was coming from.
Thank you. I appreciate that. And I do understand that. I think we've had actually even updates since then of another case or several more cases that have come through since that was published. But I do appreciate and I do understand the cost benefit. It's a difficult balance. But I think as Ray has said, working with the state, working with their plans, and considering how serious Triple E. I mean, I can recall times where we have had young people in the state, and thinking about the sports and the fields, it's a concern for me. But it is a hard decision. I don't take that lightly. But I appreciate your concerns and your sharing them. And taking the time to do that. Okay. All right. Is there any other comment or question on this that we want? Well, so do we do this as a normal motion? Or yes?
Yes.
I'll
So
make the motion.
We would
Okay.
need a
Yeah,
motion. Yep.
sure. I'll make a motion for an emergency waiver to spray Westford Public Schools and parks for mosquitoes.
Okay. Motion made. Are there any other comments or questions? Is there a second?
Second.
I'll second that.
I heard Joanne first. Michelle, sorry. Joanne gets the second. Motion made in second. So all in favor, please say aye. Stephanie, aye. Michelle,
Aye.
Sue,
Aye.
Megan,
Aye.
Joanne.
Aye.
Okay, the motion passes unanimously. Thank you. And please, keep us posted, Ray, and make sure, getting that out quickly to the community so people can follow the guidance to close windows, bring in pets, stay off the fields and outside on those nights.
Will do.
Okay, so we talked about the goals for the strategic planning. I guess now we have the discussion regarding draft department budget.
Yes, thank you. In your packet, also the public's able to see that is our draft proposed budget for fiscal 25. And I just actually want to bring up something just to show you. I know that was in your packet. Okay, wait, are you able to see that? No. Let me see. Okay, that's not gonna work. I apologize. I'm
It
bringing.
just keeps popping in and popping away.
Yeah, it's the strangest thing. Well, I do have a connectivity problem today, so I apologize. IT is trying to help me out with that. I just wanted to bring you to your attention in the budget. We did ask for the school dental program, for the money to be put back in there that was cut last year for the first time since that program was initiated. And I also wanted to just point out the revenue section. So our town did bring, excuse me, not our town, our health department did give back to the general fund through grant administration fees of $43,000. So I think that's important to share. And you'll also be able to see that our permit fees went up since last year quite a bit. So with the raising of some of the health department fees for the town to bring in that funding, I just
And we
wanted
can clarify that that is to keep things in line with what other towns are charging and what our costs are.
correct. We do
Raising
a big
rate.
analysis to make sure we're covering costs and certainly leaving it at that. So, but didn't know if you had any questions, concerns.
That's an impressive amount that you're bringing in.
Yeah, I mean, I think with the dental services, I mean, it didn't go up very much. Is that what you've been discussing with the program that it would cost?
Yeah, so right now the program costs about $3,600, and there's a lot of students that take advantage of that program. Um, we do see quite a bit of decay with some cultural beliefs here in the community when it comes to dental care. So we did ask for those funds back. We'll see. I did highlight biohazardous waste. That's our sharps collection. We're required by law to take in medical waste, which we do through the police department and health department for no cost. But however, that biohazard waste item, I took that out because the opioid settlement funding that comes to our community for the next 18 years, a portion of that funding will pay for this line item.
That's great. Okay. Does anyone have any other questions for Ray on the budget? Doing great on bringing in funds and using them well, I think, Ray. Thank you.
Sure.
And Abby. Okay. Then our next agenda item is a very sad one. It's a resignation letter for Board of Health Vice Chair position.
Yes.
We're going to miss Sue.
Yeah. Well, I'm gonna
So-
miss it. Yeah.
Yeah, resignation letter received by our Board of Health Vice Chair, which is Sue Hanley. We're going to miss her terribly.
How many years have you been on the board, Sue?
I don't remember, to tell you the truth.
That means a
It's been a
lot.
long time.
Mayflower
After the first
landed.
one, it's a blur.
You've
Yeah.
done great service for the
I know.
community in so many ways. We really, truly will miss you.
Well, it has totally been a privilege, and I love this community, and I just love how far the health department has come. I think about so many things that when I started, I was fighting for, and mental health was a big one. And to watch what you have done with it, Ray, is exemplary, and I can't thank you enough, because I think you're the one that has really kept the ball rolling in this very incredible direction, and it means the world to me. So again, it's been a privilege to be part of this community, and I think about so many things that we've gone through as a group, right? My God, well, COVID itself was probably the most memorable, but we also had the asphalt plant and lots of things that we had to come together on, and it's really been a privilege to be part of just a great group of people. And, you know, Joanne, you've been on the board off and on with me for a very, very long time.
Mhm.
So, and I was glad when you came back on. And Stephanie, you've been an incredible chair. Can't thank you enough,
Thank you.
really. And Michelle, love being on the board with you. Megan, so grateful that you joined. And Abby, you have been just an asset to the whole health department. So it's just a great group of people. And again, if I wasn't moving, I wouldn't be going anywhere. But
And your
yeah.
resignation is not
No.
Oh, we
No.
haven't accepted it yet? You mean we don't have to accept it? I vote to not
Yeah,
accept that.
yeah, yeah,
Sadly,
I've got an extra bedroom, Sue.
yeah,
We tried our darndest
Yeah.
not to get your house sold. We
yeah. Thanks.
found
October.
signs
It
and
worked for a
It's not-
while.
told
Yeah.
not until
people that
you're-
there was like mold and
Yeah,
we're
please. Oh
hoping
my
you're here
God.
till October.
Yeah, well, Abby, you know, I think Abby and Ray know what I went through with my lovely, I got to see septic firsthand. And so anyway, but yes, I am only relinquishing my role because I am moving. And I reached out to Ray a long time ago to say, do I have to resign from the board? And she said, yes, as soon as you sell, you have to go. So my closing date is October 15th in Westford. So that is the date of my resignation letter. But again, it's been a privilege and an honor to be part of this board. And I love the town of Westford. So keep doing great things, you guys. And know I'll be supporting you from afar. Well, not that far, just down the road.
Thank you,
So,
Sue, and you have
yeah.
really done so much for the town.
Yeah.
You will be
Well,
sorely
thank you.
missed.
Well, I'm going to miss all of you. So
But
thank
you're
you
still
very
here.
much. Yes, I'm still here. Yeah, you're stuck with me probably one more meeting.
We hope.
Yeah. Thank you.
Okay. Thank you. All right, then I guess we're on to new business.
Alrighty, first item up is we did receive a letter from the Massachusetts Department of Environmental Protection regarding new PFAS requirements for landfills. That was also in your packet. I did just meet today with the town manager's office, the Department of Public Works and the Water Department to discuss the letter. And we're going to reach out to the consultant, who is Weston and Sampson, to get a quote on what are the requirements. Right now, it appears that there's some extra monitoring well requirements for testing for PFAS, which is a great thing. And if there's any surrounding wells that may be impacted with PFAS from the landfill, they will be also notified and remediation efforts will be made. However, there is no funding for these mandates. So that is something the town is looking at this moment. So this was just received, just wanted to make sure you're aware of it. And Abby and I will be monitoring the situation and working with the town manager's office on how we can help and assist.
Great, thank you.
Next item is the letter to the governor's office and the Mass Department of Public Health regarding the Neshoba Hospital closure. So we did want to be proactive, as you're all aware, and that letter is also in the packet. What that was sent out, I believe, a week and a half ago, just to let them know that, you know, we would like to make sure that there are services here for our residents. I know this particular hospital was a lot of residents attended for mental health purposes and services. And, you know, these are some of the concerns moving forward is where folks going to turn to get some help and assistance with any crisis they might be going through. So we do appreciate your support, and that letter was sent out. I would just like to let the public know too that we do have a bunch of information on where folks can go for help or assistance. If they have questions about their medical records. I know that's been on the news, but we do have it up on our website. Try to order more COVID tests to kind of fill in where, you know, this medical facility and hospital, you know, did have testing. I know that the state is looking into urgent care centers and assistance for this area of the state. So more to come. We're waiting to see what happens. And It is, September is a lot of things. It's Food Safety Month. It's Suicide Awareness Month. It is Emergency Preparedness Month, all things that the health department here does work on. But I did want to make you aware of a new initiative. We did work with See a New Sun, where we purchased teal suicide awareness shirts, and we incorporated most of our departments here in the community. And so they'll wear their shirts on Fridays to bring awareness to this topic and to spark a conversation and let people know where they can get help if they're having any kind of a crisis, or just need someone to talk to, or maybe find some services. So a picture was taken on the common with all the departments, and that was put out through social media. We just wanted to thank See a New Sun. We're working with them. You've probably seen pictures as you're driving up Boston Road, and again, just to spark a conversation with you or your family, and there's help out there if you need it.
Can I just make one comment? I have to, first of all, to me, it's impressive as you drive through town and on the common, it kind of takes my breath away. But when I saw the picture of all the departments wearing the shirts, one thing I've always hoped for in this town is for departments to work together. And to me, that was just a beautiful sight to see all the departments coming together and putting these shirts on. I also just want to make sure, just in a public way here, to mention that 988 suicide prevention line. One thing about that line that I do want to make sure people know, and I know we've talked about this before, is that it is a line to talk to somebody, a trained counselor as well. So for anybody out there who's struggling or has a family member struggling, that is a number that is available 24/7. And I really do pray that people take a deep breath and a step back before making a permanent decision of a temporary problem. And I really do, it's one thing, one suicide is one too many. So I appreciate all that everybody's doing on behalf of families and people that have struggled.
Agree. The inspection software is brand new. Everyone in our department it's called Revelin or Food Code Pro. And so we're using it for food, housing, camps, and pools. So our department has just been trained on that, as using it within the last 2 weeks. So, just wanted to make you aware of it. Our grant for the department does pay for all that software. It pays for all the maintenance fees. And so that's been a great addition to keep us all kind of, some of us have what I call serial killer writing. And so, it can be difficult to read reports from one inspector to another. So it's nice to have it nice, standardized, uniform, and electronic. It's been great. So just wanted to mention that the department has been using that. We're required to let you all know. I know we put it out in the public and we've mentioned in the past, but we need to make sure it's on record that we inform the board where our community health and assessment and our improvement plan is located on our website. So that is under our public health accreditation tab under the health department website. And so our community health assessment and improvement plan and soon to be strategic plan will be listed there for the public or anyone that would like to see that.
Ray,
Great.
before
Yeah.
you go on to the next thing, I'm sorry, backup one? What was the name of the software you're using for the inspections?
It's called Revelin software, or also called Food Pro Co.
It's Food Co. Food
Oh,
Pro.
sorry,
Yeah, opposite.
I'm breaking up. So if I have like the
Okay.
permanent
Food
face,
Co. Pro.
yeah,
Food
my
Co. Pro.
connectivity is not good. Sorry.
Food. Yeah.
Okay. Just curious. 'Cause
Thanks, Abby.
we did everything with WinWham, same thing, but have never heard of Revelin. Revelin?
Yeah, it's pretty innovative.
Cool.
It's pretty neat.
Thank you. You'll have
Um,
to show me.
for sure, the Greater Lowell Health Alliance. So Brittany Nash, who is our regional community health and wellness coordinator, she comes back next week from maternity leave. We're so excited. And myself and Nicole Laviette are town's community wellness coordinator. Both work closely for grants and things like that with the Lowell Health Alliance. So I did apply last year to be on their board, and they've informed me that of a spot. So I just wanted to let you know that our health department will have a representative on their board. So we're really excited about that because they do provide lots and lots of resources, not only for our region, but specifically too for Westford. So we're excited to see that and be exposed to more grant opportunities as well. We were just at the Westford Farmers Market. We just want to make you aware. We put out all kinds of information from a variety of topics, emergency preparedness, PFAS, things of that nature. And that the farmers market, I believe it's the last week is this week. So we do try to get out there as much as I can. I know Gail did put out community boxes for the Coalition of Nonviolence so kids can communicate with their parents. It's a little box that they could paint and they kind of put questions or concerns in the box, and that way they could have a little conversation with their parents. So I know that was super popular with the kids. So just wanted to thank Gail for that and all the staff for helping with the farmers market. And the last item is septic week. I know everybody's excited about septic week, but that's next week. And so we put out lots of education to remind people to pump their tanks and to keep up with the maintenance for their septic system, because here in Westford, we're all private septic. So just trying to help people avoid those financial costs for any failed components or systems. And that's
The big thing I learned on here was, well, you missed flu clinic dates.
Oh, I blew right by the flu clinic. Sorry about that.
Yeah.
So the flu clinics, again, we're in the packet. They are on our website under our flu clinic tab. We do have one that we offer for employees, and then we have several. We have one that's dedicated to 65 and older for high dose or flu vaccine. And then we do also have two flu clinics in the evening. And those dates are October 17th and 24th, 4 to 8 p.m. for ages 4 and up. And so those links of where you can sign up for an appointment, we do accept walk-ins, but it just keeps the system and the line moving when you make a reservation. So those links are up on our website. And we encourage everyone to get a flu vaccine. At this time, we are not offering COVID vaccine. I do know that our local pharmacies have lots of appointments open, but it just comes down to volunteer capacity to be able to provide those clinics right now.
Thanks, Ray. Where would we find all the exciting septic week information?
So that'll come out this week on social media, our Facebook page, if you follow us, as well as our web page. And thanks to Abby, she does a great job with maintaining our website, putting up news flashes. So yeah, we're excited to get that information. And I know she just printed booklets for the public, so they have some more information when they find out.
Teaching us how to wash off if we have them, those, is it the filters?
The filters, yeah, everyone forgets about those, so.
I learned about them here, so.
Oh, yeah. The hard way, usually, people do.
But
It's
yeah,
usually at Thanksgiving that you find out about the filter, when you have 15 people there. Yeah. Yep.
That's how we're gonna get you back. So you're gonna have to go out with Abby and start doing septic inspections.
Well, you know something? I dealt with a firsthand experience in my backyard, so it's all good. All good. Yeah.
thank you all so much. Okay, then I think that is the end of the meeting. And so is there a motion to adjourn?
Go
I'll
ahead,
make the
Sue.
motion. I'll make the motion. Right at 7 o'clock. Look at this. Wow.
Motion made. Is there a second?
I'll second.
Michelle seconds. All in favor. Stephanie, aye. Michelle,
Aye.
Sue,
Aye.
Megan,
Hi.
and Joanne.
No, we want to stay with Sue a little bit longer. We have to make her stay.
Next time.
What can we talk about?
Dinner. Dinner out.
Aye.
Okay, that passes
All right.
unanimously. Thank you, everyone, and
All
have
right.
a good month.
All right. Let's get
Thank you.
together.
Thanks.
Let's plan to
Abby.
get together. Okay.
Thanks, Ray. Thanks,
Definitely.
Abby.
Thank you.
Thank
Bye.
you.
Take care.